Hello guys, welcome back to Nursing Guru. This is Manojsir. So hope it is clear that everyone are preparing well for their exams, which is about to come in the upcoming month, that is December. So in order to make you more confident that how you have to attend and you have to give a best in your exams, today we are here back with one of the important subject where it comes in the 6th sem, that is again the child health nursing 1 and 2. So today we are here with a question paper pattern where you can detailedly know like how you can present in your examination with the detailed answers, and not only the detailed concise pattern, how you can give your best with making like a complete note of it with proper diagrams, schematic representations, and wherever it is necessary with concise answers rather than dragging it much. So let's move on. This is the question paper pattern for the 6th semester BSc Nursing degree regular examination, which is for the year February 2025, child health nursing 1 and 2. So hope you all know like the total marks will be for the 75 marks and the time duration is for 3 hours. So please manage the time accordingly to the questions and what you are planning to write as an answer. So these are the instructions that you have to follow. So hope these are very well, because you have already been in the 6th sem, so you will be knowing the instructions how to go forward. So these are the MCQ questions. See how many questions will be there. 12 MCQ questions will be there, where choose the most appropriate answer from the options given. So 4 options will be given. So in that, one will be the correct answer. There is no like multiple answers you can give at a time. So it is all about like only one answer, that is choose the correct answer. Let's move one by one to the MCQ questions. That is question number 1 to 12. Number 1, wide pulse pressure as an indicator of large left to right shunt is seen in dash. Number 1, or A, atrial septal defect, B, ventricular septal defect, C, patent ductus arteriosus, and D is partial anomalous pulmonary venous drainage. So what is the answer? It is patent ductus arteriosus. See, patent ductus arteriosus is also called as a PDA. Why? See, it clearly says that it gives a large left to right shunt is seen in that, where bounding pulse and wide pressures are seen, and it can be clearly present in the PDA. So which is a congenital disorder, that is patent ductus arteriosus. So next is the second question, second MCQ, that is birth weight quadruple by dash. A, 5 months, B, 1 year, C, 18 months, and D is 2 years. So what is the answer? The birth weight quadruple by, answer is 2 years. Quadruple, 2 years. And next is the neonatal compression ventilator or ventilation ratio. So what is the ventilation ratio in the neonatal compressions, which is seen in the neonatal CPR, cardiopulmonary resuscitation? A, 1:1, B, 1:2, 3, 1:1, and D is 1:4. So what is the answer? Compression to ventilator ratio in the neonates is 3:1. So what do you mean by that? In the sense, 3 chest compressions followed by 1 ventilations. Okay. Whereas in the adult we know this is completely different from the pediatric. Means the adult. So adult will be like different. That is 30:2. 30 chest compressions and 2 airway breathings, and whereas pediatric it is all about 3:1. It is a ratio. Okay. So next is the fourth question, the fourth MCQ. The Oedipus complex is associated with which psychosexual stage? A, oral, B, anal stage, C, phallic stage, and D is the genital stage. So the answer is phallic stage. And fifth question, which of the following is a case of metabolic acidosis with a normal anion gap? Option A, lactic acidosis, which is also called as a shock, B, diarrhea, C, ketoacidosis, and D is the renal failure. So what is the answer? Diarrhea. So this is a metabolic acidosis with a normal anion gap. And next is sixth question. So what is the sixth MCQ? Wind swept sign or deformity is seen in which of the following disease condition? Number A, that is A option is scurvy, B is rickets, C is achondroplasia, and D is osteoporosis. So the answer is rickets. So it is a deformity, like a windswept sign or a deformity is seen in this rickets condition, which is you can see the explanation clearly. The windswept deformity is a characteristic feature which is seen in the rickets, especially in the children, which refers to one knee showing valgus deformity, that is a knock knee, and the other knee showing the varus deformity, which is a bow leg. So it is all about the musculoskeletal disorder. Okay, and next, 7th question. Exclusive breastfeeding is recommended at least for how many months, days or ages, etc. A is 4 months, C is 6 months, B is 6 months, C is 9 months, and D is 1 year. So what is the answer? 6 months. We all know that exclusive breastfeeding is recommended at least for 6 months. So that is which is completely recommended by the WHO. Okay, we should not give any other, without any additional food or drink, not even water should be given to the baby or the child. Next is 8th question. Anterior fontanelle closes at the age of dash. A 1 year, B 1.5 years, C 3 years, and D is 3.5 years. So what is the answer? 1.5 years. So we all know like anterior fontanelle, which is present in the anterior part of the skull. So it should be closed within 1.5 years. So obviously it will close within these years. Whereas the posterior fontanelle, you can see that 2 to 3 months. Next, 9th question. Pincer grasp is seen at which weeks? A 4 weeks, B 6 weeks, C 16, and D is the 36. So what is the answer? 36 weeks. See, the explanation is pincer grasp, which is also called as the ability to pick up the small objects using the thumb and index finger, is called as the pincer grasp. So what do you mean by pincer grasp? See, what you're going to, for example, a child when picking up a small piece of rice or one rice, so that is the pincer grasp again, which is an example which develops around at 9 months. So 9 months is approximately, when we are converting into the weeks, it is called as a 36 weeks. So that is the ideal part. Next is the 10th MCQ. Kwashiorkor is diagnosed in growth retardation children along with which condition, or what is the signs and symptoms? Edema and mental retardation, hypopigmentation and anemia, and C is the edema and hypopigmentation, and D hepatomegaly and anemia. So these are all the signs and symptoms where it is seen in the Kwashiorkor disorder. But what is the correct answer? Edema and hypopigmentation. The reason Kwashiorkor is a form of severe protein malnutrition. So it is a protein malnutrition which is seen in the children, which is often following the weaning. So during the weaning process, we can see that the diagnostic feature will include edema because of the hypoalbuminemia and also hypopigmentation or depigmentation because of the flag sign. So this is the rationale behind for that. And next is the 11th question. IMNCI strategy was developed by A, WHO, UNICEF and FAO, WHO and IAP, and WHO and NNF. So what is the correct answer? WHO and UNICEF is the correct answer, where IMNCI strategy was developed by World Health Organization, and UNICEF is United Nations International Children Emergency Fund. So why these two collaborated together to form the IMNCI strategies is to reduce the child morbidity and mortality through early identification and integrated management of common childhood disorders or illnesses. Next is the 12th MCQ. A newborn baby has been referred to a casualty as a case of congenital diaphragmatic hernia. So this is a congenital disorder where the first clinical intervention of this CDH, which is called as a congenital diaphragmatic hernia. What is the intervention? First clinical intervention, to be inserting a central venous pressure line, that is a CVP line, bag and mask ventilation, or C is inserting a nasogastric tube, or D ventilate with high frequency ventilator. So which is the correct answer? Inserting a nasogastric tube. Why we have to consider this as the first clinical sign? The reason, see, CDH, the abdominal contents herniate into the thoracic cavity through a defect in the diaphragm, which leads to the lung compression and respiratory distress due to pulmonary hypoplasia. So because of this reason only, first we have to insert the nasogastric tube. So in order to reduce the respiratory distress, that is the main intention here. Whereas next, so this is all about your 12 MCQs, where if you answer correctly, 12 marks you will get. Okay, so that is very much important. So always remember, if you give the correct answers for the MCQs, you can easily score, and you can also expect that 100% whatever you have written there. So always try to answer the correct answers rather than going with the confusion or the wrong one. This is all about the MCQs, and next is the essays. So we all know how many marks, how much marks we will be having for the 10 mark questions. So we will be having a 15 mark, where 15 mark we have to answer for covering that entire 75. This is the long essays. This is your long essays. So we'll see one by one. The first one is define growth and development, list the various theories of growth and development, and describe the growth and development of the infant. See, this is divided into multiple differentiation of marks. For example, define growth and development will be your 3, and again they might have been given in the question paper clearly how much marks each question carries. The growth and development may be 3, and next list the various theories of growth and development 7, and describe the growth and development will be again your 5. So totally will be of 15 marks. So this is one scenario where you can expect the questions, and where before answering to your particular questions, please always ensure that there should be a proper planning. The reason is, based on the marks you should write. Don't write the completely as per your wish. The reason is, if it is a 7 mark, you should plan accordingly how much you can express in or present the way of your answers in that particular thing. Whereas if it is for 5 marks, plan accordingly, again based on the pages or whatever it may be, or the content what you're going to write. It should be based on the marks what they have given for that particular question. Next we'll see the definition of the growth and development. So clearly write the definition, because each carries 1.5 marks. If it is a 3 mark, if it is a 4 mark, 2 each. Growth refers to the quantitative increase in the size and structure of the body or any of its parts. So it can be measured in terms of height, weight, head circumference, and other physical parameters. For example, increase in height and weight of a child. See, anything which is measurable will come under the growth. Whereas development refers to the qualitative improvement in the functioning and skills of the body and mind. It involves the maturation of physical, mental, emotional, and social abilities. So what is the example? Learning to walk, talk, think, and interact socially. So this is the definition, and with example for the development that you can write. So this is the definition for growth and development. Next, theories. Theories of growth, and this could be your 2 marks or 3 marks, anything it could be there. Okay, theories of growth and development. So there are multiple theories that which is present, or which is you can present in your answers in your question paper or the answer booklets, where you can show in the multiple theories. See, there are multiple recently introduced theories where you can add, so that will be adding an extra things in your answers. Okay, first is psychoanalytic theory, which was brought by Sigmund Freud. Psychosocial theory, Erik Erikson. Cognitive development theory, Jean Piaget. So these are the most 3, but still there are many. We'll discuss one by one. You always try to go with the precise theories which is brought by these people, where these will show the exact theories of growth and development, where you can write in detail. Psychoanalytic theory, which was brought by the Sigmund Freud, mainly has 5 stages: oral, anal, phallic, latency, and genital stages. So here you can what you can do is, see, since they have asked completely the theories of growth and development, try to explain concisely. Don't go in detail. The reason, again, you have to cover even the next upcoming questions. So plan accordingly. That is, if it is maximum 30 minutes, if you want to cover within 30 minutes, try to cover the first one question, that is the first long essay. So that you have to plan accordingly. That is, time management is a crucial part in writing your answers. Next is the psychosocial theory, that is Erik Erikson. It emphasizes social interactions and the conflicts at different life stages, where 8 stages are there. So one of the example is like trust versus mistrust. So like this, there are multiple stages where psychosocial theory can be explained in detail. Next is the cognitive development theory, which was brought by the Jean Piaget. Again, 4 stages are there according to Jean Piaget, that is sensory, motor, pre-operational, concrete operational and formal operational. So these are the 4 stages which was brought by him. Next is moral developmental theory. Moral developmental theory, psycho-social developmental theory. Moral developmental theory was brought by Lawrence Kohlberg, whereas psycho-social development theory, Havigast, and ecological systems theory, Yuri Bronfenbrenner. So this too is recently added in the the entire theories of growth and development. So you can put these last 2 points as your last theories of the growth and development. Behavioral theories, which was brought by the Pavlov, Watson and Skinner. And next is so these are the theories of growth and development. And next is the growth and development of an infant, which is another question where they covered or where they directly asked birth to 1 year. So it is all about birth to 1 year means it is infancy. Okay. So infancy, have to give a complete description here. So what are the growth and development up to 1 year, that is infancy period is, first always start with the physical growth. Without physical growth we cannot proceed further. So physical growth will be your height, weight, head circumference, teething. So those will head circumference, chest circumference, height, weight, teething, those will be the physical part, that is physical development. And next coming to the language development. So you have to explain always in the kind of months. See, always don't go directly with the years. Already it is clearly mentioned like 0 to 1 year, that is the infancy period. So always try to go with the months where you can show some important growth and developments there. So what kind of developments that you can see in the infancy period, that is in the language development, is 2 months. You can coing sounds, babbling in 6 months, and which understands with the simple words like no, yes, all those will be seen in the 10 months, that is 9 to 10 months, and 12 months where the child will start saying few words like mama, dada. So okay, so like this there are multiple things where it is completely projected on the screen. If you want, you can just go through in detail where you will get much information about one particular developments. Next is the social and emotional development, which was brought by the Erikson, trust versus mistrust, and that again it is seen in the infancy period, that is socially at 2 months, 9 to 10 months and 3 months. All these 3 places where social and emotional development plays a major role in the infancy period. And next is the play. Play also, see, solitary and exploratory play is seen in infancy. So like this you have to catch few points and where you can highlight in your answers where that is clear and you will get a direct marks. So this is all about the first question, define growth and development, theories of growth and development, and what are the developments that we can see, that is complete growth and development in the infancy period, that is 0 to 1 year. So that is all about carries 15 marks. So if you plan accordingly and if you present the way of whatever you have with schematic representations or any flow charts, and as I told you earlier, always go with the months. Months is very much important when they ask particularly one particular age. So if you start writing like that in such a way where you will show each month 1 by 1 development or a growth, you can get a best score where you more expect than, or what you more expect than that. Next is the third question, in the sense long essay. In long essay, the second question, where again it carries how much? 15 marks. A newborn with tracheoesophageal fistula, which is also called as a TEF, is admitted to a neonatal ward. This is a kind of case scenario what they have given, but still where you can see is direct question or direct concept that you can expect is TEF. Define TEF, that is tracheoesophageal fistula, discuss the pathophysiology of it, and with the symptomology, that is symptoms, and discuss medical and surgical management of TEF, and write a nursing care plan. So as I told earlier, sometimes they will directly give the marks of division of that particular question. So your definition will carry 2 marks, And next, pathophysiology will carry your pathophysiology along with symptomology, means pathophysiology plus symptoms will be of 4 marks, and medical and surgical management will be your 4 marks, and nursing care plan will be of 5 marks. So like this, it is clean and clear cut where you can present your paper accordingly. Definition: it is a congenital anomaly which is characterized by abnormal connection, that is, which is called as a fistula between the trachea and the esophagus. And what is the pathophysiology? Always try to go with the flow charts. Okay, why flow chart is important is, if you see, this is the same pathophysiology what you can write for the TEF. But the thing here, you can write in the flow chart manner that will showcase in the higher a best way, okay, which shows like a flow chart or a schematic representation. During the embryonic development, we all know, like always while writing any pathophysiology, etiology will be your first point. So here, what is the etiology or the cause? In the embryonic development, around 4th to 6th week of gestation, the foregut divides into. Since it is a congenital, the etiology will be congenital only. Okay, what are those? The trachea anteriorly and the esophagus posteriorly, there will be a failure. So this will be the cause. This is the exact cause where you can write for the first point, that is failure of separation. Failure of this means failure of trachea and esophagus formation properly during the embryonic development. It results into the blind upper esophagus, abnormal communication between the lower esophagus and the trachea will be resulted. So that is the ideal concept. So first will be the cause. Cause is the failure of trachea, proper formation or connection of the trachea and esophagus, means abnormal connection. Normal connection is fine, but abnormal connection, then it results into the fistula, which is called as a TEF. And next, this is the pathophysiology. The most common types of the TEF is, there are multiple types. In that multiple types, type C is the most commonest one, and symptomology, because second part is the symptomology along with the pathophysiology. What are the symptoms? Excessive salivation, coughing, choking, respiratory distress, abdominal distension, absence of air in abdomen, and inability to pass a nasogastric tube into the stomach because tube coils into the upper pouch, and like as you insert, you can see that in the X-rays. Okay, so these will be the some of the symptomology, which is also called as a clinical features that you can see immediately after the birth. It is not like a prolonged one, it is immediately after the birth. Next, medical management. So medical management, again as we told, it is a 4 mark. So in that medical management, always try to go with the pharmacological management first and then pre-op and the post-op. Okay, so medical management pharmacology will discuss. Before that, pre-operative management is stabilizing the patient. So that is very much important. Means post surgery, immediately we have to stabilize the patient, or post aspiration, whatever it may be. Maintain airway and prevent aspiration, maintain airway and prevent aspiration, because both esophagus and trachea are coiled together here. That is a problem. NPO, IV fluids, antibiotics, oxygen therapy as needed, and thermoregulation and monitoring of vital signs. Why? Because here the baby is too, there will be an immature thermoregulation. So that is the ideal concept. Next, surgical management. Surgical management, again, definitive treatment is surgical management. Always TEF has direct management that you can tell is surgical management. Medical management, it is all about handling the symptomatic treatments. A symptomatic treatment will be going with it. The timing mainly depends on the baby's condition. That is primary repair, which is called as the fistula is ligated and the two ends of the esophagus are anastomosed, and secondary repair, which is also called as a staged repair. For unstable infants are large gaps. When there is a large gap between these two, then we will go with the staged repair. And post-operative care. Pre-operative care already we discussed with the medical management, and post-operative the same only will be there, but it all about the post-operative care with the proper position, that is the semi-folus. Why semi-folus? To prevent the aspiration again. Next, nursing diagnosis. So this is an important concept where you have to focus with, where how many marks? This is totally 5 marks. So what is the 5 marks that how it will be divided. See, always the parameters should be like this. Since it is a theory exam, again I am telling, since it is a theory exam, only 1, 2, 3 and 4 columns, and if required you can write the assessment part as your first, and second will be your nursing diagnosis, third will be your goals or objectives, and fourth will be your nursing interventions, and fifth will be your evaluation. Cleanly you have to understand only one thing. In theory only 5 columns we are following, whereas again in the practical there will be one more adding part which is called as a implementation. I think it is already available in our channel. Please go and watch on nursing diagnosis and care plan. So there is a separate video on this. Please try to read and learn much things to understand in detail how to present a care plan. So what are the nursing diagnoses that you can write for a child who is having a TEF, risk for aspiration and related to regurgitation of saliva and gastric? See, it is like always there are 2 types of what is the nursing diagnosis. One is the actual and the potential. These 2 will be your actual, but it depends on the condition at that particular situation how it goes on. So these risk for infection related to aspiration pneumonia or surgical wound, imbalanced nutrition less than body requirements, which is related to inability to feed orally, and acute pain, which is related to surgical procedure. So these are the most prioritized nursing diagnosis, where this will be your potential diagnosis and this will be your actual diagnosis. Clear with this? And before proceeding with that, this already we have discussed in the previous videos as well. First, whenever there is a nursing management or nursing diagnosis, directly don't go with the diagnosis. Write something about the nursing management, where nursing management you have to mention first point as the nursing assessment. Next will be your first will be your nursing assessment, and second will be your nursing diagnosis, and third will be your nursing care plan. In this care plan only you will be writing the interventions along with that. Always remember, whenever they ask for your 5 marks for 5 marks of any nursing management of one particular condition, you have to present in this manner. Next, coming to the short notes. Short notes is all about again your short essays. We all know short notes, 5 marks will be there, that is we also call it as short essays. So 5 into 5, 25 marks. So again for 10 marks or for 15 marks, again you can proceed almost somewhere around 7 to 8 pages. The reason, earlier we had a year people where 5 pages is the a minimum that we were recommending for them to proceed for the 10 marks. Since it is again for 15 marks, try to proceed with the 7 and 8 pages to complete your entire 15 marks. Whereas for the short essays, you can go up to 3 pages. Okay, 3 pages try to fill. It is not only filling what you're going to fill, there should be some logical thinking and reasoning behind that. So we'll discuss one by one. That is importance of play in children, first question. So already we discussed play is much important in growth and development of a child. So how it is important in children, we have discussed multiple, in the sense we have described in multiple developments, that is a physical, cognitive and the emotional development, social development, moral development, therapeutic value. See, almost this much, there are multiple, since it is a concise way where I have told your answer should be concise, but at the same time it should be very much valuable. So in that case, always try to write the direct answers instead of writing something a general then coming to the specific. So always go with the specific things, because see, as I told, physical and there are multiple ways, social development, psychological, sexual, moral development. So according to the development, how the play is important, it is clearly mentioned here. So you can detailedly study one by one. And next is the types of hypospadiasis. So again it is a genitourinary disorder. So always when they ask like something direct question, again here in this manner you have to go from general to specific only. So first what you can do, you write the definition of hypospadiasis, and then you can go one by one what is the types. So what are the types of hypospadiasis? Anterior, which is also called as a distal hypospadiasis. Middle, penile hypospadiasis. Again in this there are multiple types. See, in anterior there is a glans type and coronal type. And in the middle or penile hypospadiasis, again subcoronal type, midshaft type, distal penile type. So like this, when you are writing, try to go with the flow charts. Either mention like this or you do mention like this. Always remember one thing, schematic representations and flow charts are very much important, because this will give a higher impact than what you mention one by one. Okay, schematic representations are very much important. So next is the third type of hypospadiasis, that is posterior, which is also called as a proximal hypospadiasis, and again it has a subdivisions of penoscrotal, scrotal type and perineal type. So these are the types of hypospadiasis which directly you can write for your 5 marks along with the definition. Next, coming to the sixth question, that is the management of asthma. That is the third question in the short answers. Okay, short essays. So what is the management of asthma? So first you have to write the definition. What is asthma is? Okay, what asthma exactly is? It is a chronic inflammatory disorder of the airway. That is the most important thing, which is characterized by recurrent episodes of wheezing, breathlessness, chest tightness, and also coughing, especially at night and also early morning because of the chest congestions and mucus productions. The main goal of the management is to achieve the long-term treatment control, and prevent the exacerbations, means the worsening. That is the ideal management of asthma. So once the definition is done, then go with the assessment and the monitoring part. As I told you, since they mentioned the management, you can write multiple things. So if it is a management, just go with the medical management, which is also called as a pharmacological, and then go to the pharmacological, and then that whatever the medical management will be there, and next will be your if there is a surgical condition, you have to write the pre-operative, intraoperative and the post-operative, and third will be your nursing management. Again I'm repeating, it is like first will be your medical management, next will be your surgical management if it is a surgery case, and third in that surgical management will be your pre, intra and the post. Whereas next will be your nursing management. In that nursing management, I told what are the parameters to be entered. So assessment and monitoring of asthma, so that you should write. Okay. So next is the non-pharmacological managements. See, always know one thing, whenever you're writing something, a management as we discussed, non-pharmacological and pharmacological, again you can divide. The reason is, first we have, being a nurse, this is the most crucial part to go with it. First we complete the non-pharmacological management only, then we can go with the pharmacological management, which mainly deals with the drugs. So non-pharmacological will be a patient education, avoid triggers, environmental control, vaccination, regular exercises and weight management in the patients, or like in the patients in the sense here it is the child. Okay. Obese child will be there because of the macrosomia or whatever it may be. So this will be the non-pharmacological management. And next is the medical management. Means in that medical management, again, see medical in the sense like not only the drugs, non-drugs, that is non-pharmacology also will be the medical management. Again, I will tell a clear point. Medical is subdivided into non-pharmo and pharmo. Okay, pharmacological and non-pharmacological. Always write the non-pharmacological first, and next will be your pharmacological, and then will be a surgical, that is pre, intra and post, and finally will be a nursing management. So pharmacological management, you can write the medicines. Here I have clearly mentioned all the medicines which is like we are using in the for the management of asthma. So you can write all these drugs one by one, okay, whichever you feel. For example, formoterol, budesonide and duolin, like derphylline. So these are all the medicines that we will be using as a pharmacological management of the asthma. Okay, next, management of exacerbations. Okay, management of acute exacerbation, which is also called as a asthma attack. So this is again a continuation of the management only, where this will be sometimes again they will directly ask for your 5 marks or even for your 2 marks. So that is the reason in the management only we try to show what is the management of acute exacerbation as a separate concept. So what will be the symptoms is severe breathlessness, wheezing, cyanosis, and emergency management. What you can do immediately once this acute exacerbation, which is called as the asthma attack, occurs: oxygen therapy, nebulization, and systemic corticosteroids, IV fluids, and magnesium IV sulfate, which will be given IV, and oxygen saturation means improving the airway, and mechanical ventilation if impending respiratory failure. That is mechanical ventilation in the sense it is all about the intubation. It may be like a NIV, mask, or whatever it may be. First they will go with the nasal prongs, followed by face mask, and next will be your NIV, and finally will be your intubation. Okay, next is the patient education. Always know only one thing, patient education is also a part of the management, no matter adult health nursing or the child health nursing. So here patient education will be focused for mothers in handling the children. Okay, in handling the children, that is very much important. That should be your in handling child. That should be your patient education. Not you're not directly giving any education to the child. So you're giving for the mothers in handling the child, how to handle it. Next, the drugs used in nephrotic syndrome. So you all know nephrotic syndrome. Again, it is a genitourinary disorder. Okay, genitourinary disorder. So you can see what is nephrotic syndrome in that, where edema and proteinuria, all those conditions will be like symptoms we can see in that. What are the drugs that you can use is, this is a direct question where after the definition of the nephrotic syndrome, you have to directly go to the drugs which we are using. So what are the drugs? First line therapy will be like corticosteroids. Corticosteroids are the first line therapy, where these medicines you can give, such as prednisolone, methylprednisolone. So there are some specific corticosteroids where you can remember, because these are basically used in the pediatrics. Okay, next is the immunosuppressive agents such as alkylating agents, cyclophosphamide, and calcineurin inhibitors, antimetabolites, monoclonal antibodies. So there are many other drugs, diuretics and ACE inhibitors, and anti-hyperlipidemic agents, which breaks down the lipids, which is also called as anti-lipidemic drugs, anticoagulants, antibiotics, or antimicrobials. So there are multiple examples that have enclosed here, so you can have a look one by one. And next is the management of ADHD. So again, this is another important 5-mark question. Management of ADHD. So what is ADHD? Again, it is a behavioral disorder. Okay, it is a behavioral disorder. So how we are going to manage the ADHD, which is most common in the children? So management of ADHD mainly involves a multimodal approach. It cannot be like only a nurse can do or only a doctor. It is a multimodal, which is also called as multidisciplinary team, MDT. Okay, combining the behavioral education, pharmacological interventions, which based on the child's age, symptoms, and the functional impairment. So based on all these only, the management of ADHD will be decided and we can proceed with it. So behavioral management, what you can do: parent training and counseling, and behavior therapy, and educational interventions. So these will be the behavioral management, that is behavioral management such as like parental training and the counseling, behavioral therapy and educational interventions. And next will be the pharmacological management. Pharmacological management, see here since it is like a child, only behavioral therapy alone cannot do best as much as it can. So what we can do, so along with this behavioral therapy, we have to go with the pharmacological management, that is drugs, that is stimulant medications, that is first line treatment for the most children will be the methylphenidate and amphetamines. So these are the drugs that we used in the treatment of ADHD for the children. Next is the psychosocial and supportive therapies, which is also a behavioral therapy, a kind of supporting structure. Cognitive behavioral therapy, which is called as a CBT, social skill trainings, family therapy will be given for the parents, and lifestyle modifications such as maintaining a regular sleep, limit screen time, how much ever it is required, and encourage the structured routines for homework and play. So this homework and play plays a major role in the children in modifying the behavior of the child, which will try to avoid resulting in the ADHD. Next is give reasons. So these all the 5-mark question or short essays that where you can expect in your question paper or a question paper pattern what we had discussed right now. And next is the give reasons. Give reasons, as we know, like there is a 2-mark questions in our pattern as well. So sometimes there is a high chances to ask a questions like give reasons, where you have to explain why it is required. So why it is so and so. So what are those give reasons or 2-mark question that we can expect is, we'll discuss one by one. Knee chest position helps in, knee chest position helps in child with the tetralogy of Fallot. So why knee chest position helps in child with TOF, tetralogy of Fallot? Why it is important or why it helps? Because see, the position effect, flexing the knees and hips bringing the knees to the chest compresses the femoral arteries. Because of this, there is a reduced right to left shunt. Okay, there is a reduced right to left shunt where the higher systemic resistance pushes more blood from the right ventricle into the pulmonary circulation directly instead of shunting it, where it through the through the ventricular septal defect into the aorta. Okay, so it improves, because of this there will be improved oxygenation where more blood goes to the lungs for oxygenation, reducing the cyanosis and relieving the TED spell. So we all know tetralogy of Fallot is again there is having a abnormal shunt from the right to left. In that case, when we do the position called as a bringing knee to the chest, that is called as knee chest position, then it will improve the oxygenation. That is the reason behind. Next is the hypercholesteremia. Hypercholesteremia is a common clinical feature in nephrotic syndrome. How? Why? Because nephrotic syndrome, we all know there will be massive loss of protein, which is called as a proteinuria. Okay, proteinuria will be the major clinical feature or a manifestation that we can see in the nephrotic syndrome. In this hypercholesteremia, how it is a common clinical feature means because of proteinuria is losing. In that especially albumin will be there, where because of more albumin is excreting out, again loss of protein, especially the albumin in the urine, this results into the hypoalbuminemia and proteinuria. This leads to the hypoalbuminemia, as I told you now, where because low serum albumin will be there. The liver compensates by increasing the synthesis of proteins, which includes the lipoproteins such as cholesterol, triglycerides, LDL and very low density lipoproteins. However, although hypoalbuminemia and proteinuria is seen in the nephrotic syndrome, the catabolism of lipoproteins is decreased, leading to the accumulation of lipids in the body, that is the blood. So as a conclusion part, see, once there is a protein loss, decrease albumin, that is a hypoalbuminemia, where there is a direct impact on the liver, which increases the lipoprotein synthesis. That lipoprotein synthesis, what it will do, it will increase the cholesterol, which is called as a hypercholesteremia. Okay, increased cholesterol and lipids will be there because of the increased lipoprotein synthesis on the liver. So that is the ideal clinical feature which we can see in the nephrotic syndrome. This is one reasoning. Next question is, newborn with spina bifida should be given prone or side lying position. So why we should give like a newborn with spina bifida, which is a condition, again it is a musculoskeletal congenital disorder, why we should give the prone and side lying position for the child who is having this condition. We'll see. A newborn with a spina bifida should be placed in the prone or side lying position because these positions prevent the pressure and trauma on the exposed spinal defect which is on the back, that is myelomeningocele sac. So these sacs will be present on the infant's back. Okay, they reduce the risk of the sac rupture, infection and cerebrospinal fluid leakage. So that is because of these two, that is to reduce or prevent the pressure and trauma on the exposed spinal defect which is there on the back of the child in the spina bifida. This position will be like very advisable or very much important. Next, see, and also the position also keeps helps in keeping the surgical site clean and dry before and after the repair. That is also one more reasoning why we are placing the child who is having a spina bifida in the prone or side lying position. Next is the ribbon-like stool is seen in child with Hirschsprung's disease. So why ribbon-like stool is seen in child who is having a Hirschsprung disease, which is a GI disorder? So in Hirschsprung disease there is an absence of a ganglion cells in the distal part of the intestine, usually seen in the rectum and sigmoidal colon. Because of this, the segment of the bowel cannot relax properly, which leads to the functional obstruction. As a result, the stool has to pass through a narrow constricted segment of the colon. This causes the stool to become very thin, and where because of the thin structure, the ribbon-like stool will be seen. Okay. So as a summary part, let me tell, because of the absence of the ganglion cells, there is no peristalsis happening. Peristalsis means the movement. Since there is no peristalsis happening, constricted bowel segment will be there. The bowel segment or bowel will become constricted. Because of that, stool will be squeezed through a narrow. See, since there is a squeezing in that, stools will be squeezed through the narrow area where the end product, that is the stools, can be notified as a ribbon-like stool. So that is why in Hirschsprung's disease, ribbon-like stool will be seen. So this is the end of child health nursing pattern question paper where we have discussed. So hope you are much clear with whatever we have discussed till now. If you still have any doubts or clarifications on this, please drop a comments, or if you want any further videos on the topic, like any subjects, it may be not related only for the SEM or the year, or any upcoming videos if required, please let us know by dropping a comment. So thank you.